You have to understand your child's psyche. And believe me, studies have been done by psychologists and psychodermatologists, where they have shown that 65 to 70% of teenagers suffering from acne suffer from anxiety, depression, social withdrawal problems.
My God.
Imagine it is that high. Someone has oily skin type, then he has to use a balm or a cleanser which will remove the dirt and grime from the face. Somebody who has a dry skin type has to use a fragrance free, soap free cleanser so that it does not become dry further. And there are special cleansers for patients with sensitive skin types. The use of all these herbal remedies is also mentioned in our Vedas.
Okay.
It is not unscientific.
हमारी जो महिलाएं बहनें हैं, अपनी जो घर की बच्चियां हैं, जो इनर्स यूज करते हैं, दे आर यूजिंग पैडेड वंस. ओके, ऑफ कोर्स उसके काफी साइड इफेक्ट्स होंगे. इज इट सो दैट दीज काइंड ऑफ फैब्रिक्स मे कॉज एनी काइंड ऑफ स्किन प्रॉब्लम?
Yes, definitely.
अगर समझो आपको एक्ने आया और वो पिंपल आया, तो व्हाट इज द बेसिक थिंग्स वी शुड फॉलो कि वो अपने आप गिर जाए?
See, the acne is not going to resolve on its own. It needs help. Okay? Like,
Welcome to another episode of the Arcade Talk Show, the show curated, crafted and created by life, from life, for life. आज हमारे साथ जुड़े हैं डॉक्टर विजय आसवानी, जो पिछले 34 सालों से एस्थेटिक डर्मेटोलॉजी और डर्मेटो सर्जरी के फील्ड में काम कर रहे हैं. स्किन, हेयर और कॉस्मेटिक ट्रीटमेंट्स में उनका एक्सपीरियंस बहुत ही वास्ट और वैल्यूबल रहा है. अपने इतने सालों के मेडिकल करियर में उन्होंने हजारों लोगों को स्किन और हेयर से जुड़ी प्रॉब्लम से बाहर निकालने में मदद की है और उन्हें हेल्दी और ग्लोइंग स्किन पाने में गाइड भी किया है. डॉक्टर आसवानी मॉडर्न डर्मेटोलॉजी टेक्निक और एडवांस्ड एस्थेटिक प्रोसीजर्स का यूज करके पेशेंट्स को इफेक्टिव ट्रीटमेंट और प्रॉपर गाइडेंस देते हैं. आज के इस एपिसोड में हम स्किन केयर, हेयर केयर, एक्ने, सीरम्स, सनस्क्रीन और डेली रूटीन से जुड़े कई इंपॉर्टेंट सवालों के जवाब देने वाले हैं, जिसे आप अपनी स्किन और हेयर को बेटर तरीके से समझ और केयर कर पाएंगे. वेलकम डॉक्टर.
Namaskar.
हाउ आर यू?
I'm fine. Thank you.
गुड टू सी यू ऑन माय पॉडकास्ट. ये पॉडकास्ट के बारे में, एज आई सेड अर्लियर ऑल्सो, द डे व्हेन आई थॉट दैट आई विल बी क्रिएटिंग समथिंग लाइक दिस, सबसे पहले नाम अगर स्किन केयर और हेयर केयर में कोई आया था तो वो डॉक्टर आसवानी.
Thank you so much.
Because of course I know you since almost 1.5 decade. My family knows you and काफ़ी लंबा सफ़र रहा है आपके साथ ट्रीटमेंट्स को लेकर. डॉक्टर साहब, स्किन एंड हेयर, दे बोथ आर known to be वेरी सेंसिटिव, क्लोज टू हार्ट. किसी की भी, अगर वो एज ग्रुप बच्चों का हो या बड़ों का, बच्चों का मतलब 16, 17, 18 के आगे, और एज्ड हो 60, 65, 70. तो इफ़ यू सी, देर आर, विल टेक फ्रॉम दी older generation, 60s, 70s. If you see in some old families, still aunties, uncles, they have a glowing skin. Irrespective of the complexion, their skin glows. Okay? There, और अगर हम रिवर्स में, हम कभी कभी कहते हैं ना, अरे रिवर्स एजिंग हो रहा है उनका, ठीक है?
Right.
And they are in 60s, they are in 70s, even in 80s. I've seen skin is glowing and they are actually, skin becomes a reverse aging format, जिससे आपका अपीयरेंस समझ में आता है. राइट. सेकेंड इज, जब हम 30s में, 40s में हम देखते हैं तो बहुत सारे जो युवक है, युवतियाँ हैं, उनकी जो स्किन है वो बहुत सारे कॉस्मेटिक डाल के वो ग्लो करते हैं. समझ नहीं आता है वो फैक्ट वाली स्किन है या वो उसके ऊपर हमने कोई लिप अप होती की है। एंड ऑफ कोर्स जब हम 20s में रहते हैं तो अपनी स्किन एक नेचुरल ग्लो करती है, राइट?
बिल्कुल।
सो ये जो फॉर्मेट्स है एज वाइज 20s 40s एंड 60s में, इसके बारे में थोड़ा सा हम डिटेल में जाएंगे।
श्योर।
सो स्किन की क्या क्या टाइप्स होती हैं बेसिकली?
राइट। सो अभी हमने कहा जाता है स्किन इज द मिरर टू द सोल। ये
Definitely.
बिल्कुल सही है। जैसे आपने जिक्र किया कुछ समय पहले कि हमारे पूर्वजों का किस तरह से स्किन ग्लो किया करता था, अभी भी करता है जो जीवित हैं। इट्स बिकॉज ऑफ देयर हेल्दी लाइफस्टाइल, the kind of discipline that they follow in their day to day existence, the kind of food that they consume, and the de stressors that they use day in and day out. Because it is very important to keep a calm mind to have a glowing skin. You cannot apply layers and layers of makeup to get a naturally, identifiable glowing skin. It has to come from within. Okay. Now, what is the common way of finding out, for a youngster or for a middle-aged person, their skin type? Ask them to wash their face with a gentle cleanser. Wait for 30 to 40 minutes without applying any product, okay? And look at their skin. If their skin is shiny and feels greasy, that means they have an oily skin type.
Okay.
Now, if their skin becomes dry and flaky and feels tight, that means they have the dry skin type.
Okay.
Now, if they have oiliness on the forehead and the central part of the face and dryness on the cheeks, that means they have the combination skin type. Okay. And there are some people who have sensitive skin. Now, their skin burns or stings or becomes slightly red even after washing it with a gentle cleanser. So, these are the common
Types.
skin types that we normally deal with in most of the patients.
Okay. So general cleansing in the sense, are we talking about the soaps which we use, which is there in the commodity market? Like अभी तो फेस वॉश, जेल, फेस वॉश ये सब अभी आए हैं। प्रॉब्लली 25 साल पहले जब व्हेन वी वर इन आवर कॉलेज टाइम, ये फेस वॉश वगैरह हुआ नहीं करता था। ठीक है,
Right.
हुआ करता था बट इतना अवेलेबल नहीं था।
Right.
तो उसके पहले people used to use Rexona and Lifebuoy and Shikakai soap and all, right? तो cleansing agents जिसको हम कहते हैं, ये are we talking about soap or are we talking about the face wash which is available in the market?
Yeah. So normally we don't recommend the regular soaps like, if I can name brand names that we have been using over the years or decades, like Rexona, Hamam, Lifebuoy, because they tend to strip the oil from our skin and cause dryness. They affect the skin protective barrier and can cause problems. See, the awareness was not there. Ignorance is bliss, they say. See, the awareness was not there before. That is why, and the availability. There were no good cleansers for sensitive skin, for various types of skin available 30, 40 years back. So people were using what was available to them,
Right.
not knowing that they were damaging their skin. Okay. So there is no one formula for everyone.
True.
No, the patient's skin has to be examined by a qualified dermatologist, and the dermatologist has to determine the right kind of soap or cleanser for that particular patient.
Okay.
So, if someone has oily skin type, then he has to use a balm or a cleanser which will remove the dirt and grime from the face. Somebody who has a dry skin type has to use a fragrance free, soap free cleanser so that it does not become dry further. And there are special cleansers for patients with sensitive skin types.
Oh, so it's all about science. Definitely,
Yes.
you
Yes.
happen to be a doctor, तो आप उसको और बेहतरीन तरीके से समझाओगे। बट ऐसा कॉमन पर्सन, जैसे आपने बताया कि फ्लेकी स्किन हो या ड्राई स्किन हो या ऑयली स्किन हो, उसको कैसे आइडेंटिफाई किया जाए? तो आधे घंटे के बाद आप जब अपना मुंह धोते हो किसी भी क्लेंजिंग एजेंट से और आपको पता चलता है कि आपकी स्किन का टाइप क्या है, और उसके बेस के ऊपर यू कैन अप्लाई इधर ऑयल और आई मीन वट एवर मॉइस्चराइजर और समथिंग लाइक दैट. पहले के ज़माने में, आज से 25, 50, 100 साल पहले, प्रॉबली 50 साल या 100 साल पहले, ये सब तो था नहीं. सो आई एम श्योर तभी बेसन का आटा, मलाई, ये सब चीज़ यूज़ हुआ करता था. एंड दैट यूज टू बी अ होम मेड रेमेडीज, राइट? सो इज in today's world, can we still use the same elements of things which is grown in our own house, grown in our own house, in the sense made in our own house?
Yes. Now, there are so many natural remedies, which are talked about online also, and the knowledge is passed on from generation to generation. All this also has a scientific basis. The use of all these herbal remedies is also mentioned in our Vedas.
Okay.
It is not unscientific. Now, when you just mentioned using gram flour powder or besan along with malai, our ancestors knew that besan is a scrubbing agent, a deep cleansing agent. That is why you have to add malai to moisturize so that the skin does not become dry, what I was talking about a couple of minutes back.
Okay.
So everything is actually based in science. Okay. Our ancestors were great people. Everything that they have recommended is based in science. The present allopathic community is picking up ideas from our Vedas only, but doing scientific study in the scientific labs, trying to find out evidence to justify what was known to our ancestors centuries ago.
Very beautifully put. Very beautifully put. In fact, I remember my grandparents used to always, whenever you used to go to village, they used to use this kind of homemade scrubs कि आपको घिस घिस के हमने लाते हैं, जैसे दादी नानी जो करते हैं वो. So in today's world also, if we use the homemade remedies like the besan, and it is okay.
Yes, absolutely, if done correctly, and if it is made in the right manner.
Okay.
That is very important.
Like, can you please put
See,
some
it is
light on
like making the medicine in the right potency,
Okay.
in the right proportion. If you don't make it in the right potency or the right way, it can have side effects.
that? Okay.
So always learn from the expert, who knows to make these kind of home remedies the right way, and then you can definitely adapt these, into your routine.
Okay. So can we have some basic understanding about if I have to make something at home? Like अभी of course घर की महिलाएं हैं या घर के जवान बच्चे हैं जो अभी अभी 16, 17, 18 साल के हो जाते हैं, तो वो भी मार्केट में जा जाके बहुत सारा करते हैं. और आज की डेट में तो ऑर्गेनिक इज़ अ न्यू ट्रेंड, ऑर्गेनिक इज़ अ न्यू लाइफ. पहले के ज़माने में हम हल्दी घर पे बनाते थे, अपने अपने खेतों से लेके आते थे. अभी ऑर्गेनिक हल्दी का एक अलग यूनिवर्सल मार्केट तैयार हो गया है. एंड इवन किड्स ऑफ टुडेज जनरेशन, सो वी कॉल देम मिलेनियल्स और जेनजीज, they are also talking about organic. So can you give some tips on how we can create our own basic home remedy, जहाँ सैटरडे या संडे के दिन हम वो लेप लगा लिया चेहरे पे तो थोड़ा सा ठीक लग गया.
Yeah. Now, teenagers, with acne skin can take 1 tablespoonful of multani mitti powder, very finely grounded. Okay, so 1 tablespoonful of multani mitti, add 2 to 3 drops of glycerin to moisturize, to moisturize. Okay, that is the scientific reason behind adding glycerin to the mixture. Okay, so multani mitti absorbs the oil, but you don't want to remove all the oil from the skin. So you need to add a mild moisturizer which does not worsen your acne also. So glycerin, as we call it, is a non-comedogenic moisturizer, meaning it does not worsen your acne.
Okay.
So that is the scientific reason for adding glycerin. 1 to 2 drops of rose water and a pinch of turmeric, which has antibacterial properties.
So the organic turmeric which we talk about, right?
Yes. Or medical grade turmeric. So you make a paste, apply it on the face over your acne. Keep it for 15 to 20 minutes and rinse it off with lukewarm water. If you do this once a week, it will help your oral and topical medicines in resolving your acne sooner. So that is how you can incorporate these home remedies in a scientific manner to help your routinely prescribed medicines.
Very nice. I mean, definitely this will help our audience to understand if they do it in the right manner. Okay. Now, glycerin is the same thing which we जो इसमें use
Yeah,
होता
we
है.
have medical grade glycerin.
Okay.
Yeah,
So,
which is available at a routine medical store. You just
Okay.
have to tell them to give you medical grade glycerin.
now coming back to the same element, हम दिवाली में उत्तन लगाते हैं, right? And couple of Ayurvedic workshops which I have attended, they always prefer using, I mean, उनका तो ऐसा कहना है कि साबुन लगाना ही नहीं है. यूज उटन, जैसा जिसे हम मराठी में उटनक कहते हैं, एंड स्क्रब इट ऑन योर बॉडी, ऑन योर स्किन, लीव इट फॉर couple of minutes and then just wash.
Right.
Your body will be, of course, giving you a good fragrance aroma. You will smell good and it will be always healthy. How from medical perspective ये कितना फैक्ट है, या ये आज की मॉडर्न लाइफ में कितना इसको डॉक्टर्स एडवाइस करेंगे?
So like I said, it cannot be used by every single person, you know. One rule does not apply to all. Okay. Now, if patient has certain eczematous conditions or psoriasis or some infective pathology affecting them, and if they start using scrubs, even though they are natural, it can worsen their eczema, their psoriasis or infective pathology, you know. So it should be done under the guidance of a good Unani physician who has good idea about herbal remedies.
Okay.
You know.
So not advisable for all.
All to adapt, you know, the same thing.
If he is in good condition, if he is healthy, then he can definitely.
Yes, and has a normal skin type. If somebody has got very dry skin type and you use natural scrubs, it will worsen his or her dryness. You know, so such patients should avoid these kind of natural remedies also.
Okay.
Yeah.
Now, when we talk about the entire process of taking skin care, okay, we'll come to a topic which is very personal hygiene जिसको हम कहते हैं. Okay, in today's world, we stay in India, we live in India. India का जो climatic condition है, जो temperature है, right from Delhi से कन्याकुमारी तक, एक पर्टिकुलर सीजन के हिसाब से हम काम करते हैं. लाइक मानसून है, विंटर है, ये जो सीजनल क्लाइमेटिक चेंजेस होते हैं, उसको हम पर्सनल हाइजीन्स के लिए कैसे यूज़ किया जा सकता है, कैसे वो चीज़ करनी चाहिए? बिकॉज अगर हम कोई इनर्स यूज़ करते हैं, कोई इनरवेयर्स यूज़ करते हैं, आज की डेट में एक नया फॉर्मेट आया है वेयर यू डोंट फील लाइक यू आर वेयरिंग एनी इनर्स. ओके. ऑल्सो हमारी जो महिलाएं बहनें हैं, अपनी जो घर की बच्चियां हैं, जो इनर्स यूज़ करते हैं, दे आर यूजिंग पैडेड वंस. ओके. ऑफकोर्स उसके काफ़ी साइड इफ़ेक्ट्स होंगे. Is it so that these kind of fabrics may cause any kind of skin problem?
Yes, definitely. See, for the hot, humid climate of Mumbai and so many cosmopolitan cities in India, it is preferable to wear clothes befitting the season of the year. Now, during summer, the humidity level is very high, and pre-monsoon also the humidity is very high. We perspire a lot and we are exposed to a lot of pollution when we commute. Now, for such conditions, weather conditions, we should definitely wear loose cotton clothes.
Okay.
One should avoid jeans or tight fitting clothes because it will worsen the skin conditions, you know, if you are facing any. So it is definitely preferred to wear cotton clothing, you know, in hot, humid conditions. Yeah.
Okay. And in a couple of your videos which you were talking about, how to take care of personal hygiene, how to take care of your inners or your clothes, how to wash them, what are the things which we should be taking care?
Right. Now, during summer, you know, we should preferably take bath twice a day. Okay. Wear loose cotton clothing. One should immerse our clothes in hot water for about 15 to 20 minutes. Okay. You may or may not add an antiseptic. Okay. Just immersing your clothes in hot water is good enough. Okay. And then wash your clothes separately in the washing machine.
Okay.
Preferably, don't wear innerwears at night.
Okay.
Yeah. So wear your night clothes, pajamas or whatever you want to wear. Okay. Avoid innerwear. Your skin has to breathe at night.
Okay.
You cannot keep it covered 24 hours a day. This is what our elders also used to do, but because of Victorian ideas that came into the country, this became a norm. So we are going back to our origins, now.
How this Sanatan thing has really, it was a very blissful thing for people like us, जिन्होंने सच्ची में अपने वेदों से पुराणों से इतना सीखा एंड ऑल ऑफ अ सडन वो कहते हैं ना कि किसी देश को ख़त्म करना है तो उसकी एजुकेशन सिस्टम को आप ख़त्म करो, अपने आप देश ख़त्म हो जाता है।
Right.
तो आज हम सैटरडेज एंड संडेज हॉलीडेज मनाते हैं बिकॉज हमको 100 साल पहले किसी ने एजुकेशन सिस्टम को इस तरीके से बता दिया कि भाई आज के दिन आपको छुट्टी लेनी है, ओके आपको ये ऐसे ही करना है, आपको वैसे ही करना है। तो आज हम कभी कभी मैं इतने पॉडकास्ट में देख रहा हूँ, every learned person is talking about the roots.
The roots, absolutely.
Okay. What do you mean by acne?
Yeah. Acne, or in common parlance, pimples, We get acne because of various factors. Mostly it is because of some genetic predisposition to develop acne. Not all teenagers develop acne. So there has to be a genetic predisposition to develop acne.
Okay.
There may or may not be a family history of acne, both sides, mother's side and father's side. So it is present in usually 23 to 27% of patients. In the rest, there may be no family history of acne and the patient may still develop acne. So there is a genetic predisposition in that particular person to develop acne. The other factors like hormonal factors, which is one of the main causes for acne, okay, besides stress, exposure to pollutants, wrong dietary habits, these worsen acne. Using the wrong kind of cosmetics worsens acne. So we call it acne cosmetica, Okay. So these are aggravating factors of acne. But basically, it is due to your genetic predisposition with the strong influence of hormonal factors,
Okay. So ये जो पिंपल्स आते हैं उसको हम पॉप अप करते हैं, ठीक है।
So you should not pop your pimples.
वो टेम्पटेशन आ जाता है, आया है, मतलब अगर मेरे पार्टनर के भी चेहरे पे कुछ आया तो ऐसे लगता है उसको मैं पॉप अप कर दूं,
राइट।
सो वो होता है कभी कभी सबकॉन्शियस माइंड में हम कुछ काम कर रहे हैं और वो सबकॉन्शियसली अनकॉन्शियसली अपन वो पॉप अप कर देते हैं, देन देयर इज अ मार्क और वो मार्क महीनों रहता है।
यस,
राइट, वो महीनों रहता है और फिर रोज़ हमें उसको देखना पड़ता है। अगर समझो आपको एक्ने आया और वो पिंपल आया तो व्हाट इज द बेसिक थिंग्स वी शुड फॉलो कि वो अपने आप गिर जाए?
या see, the acne is not going to resolve on its own. It needs help. Okay, like I said, the number one factor responsible for development of acne is hormones. Okay, and certain structural changes which happen in your pilosebaceous unit. It is the unit which constitutes your hair along with the oil producing glands called the sebaceous glands.
Okay.
So the opening gets blocked. Okay, bacteria seep in and produce those inflamed or red pimples or pus-filled pimples. Now coming to that point that you raised, popping a pimple, why should we not play with our pimples? Because what it can do is it can shift the inflammation and infection inside
Reverse
the skin and create bigger problems and lead to scarring, which we don't want. Okay, and playing with the pimple also leaves behind what is known as post-inflammatory hyperpigmentation. It is the mark left behind on your skin after the redness or inflammation subsides,
Yes.
And then one has to take treatment from a dermatologist for all these problems. I always tell my patients, please start treatment for acne at the earliest to avoid these kind of pigmentary problems or complications and scarring. Lot of people come to us very late because their elders tell them that this is something normal, this is something natural. We also used to get acne. Why do you want to go to a dermatologist and get yourself treated? So I have to not only deal with the patient but also his or her parents, trying to convince them that treating acne on time will prevent these complications. Number one. Number two, you have to understand your child's psyche. You think that this is only an external thing which is present on his or her face. Please talk to your child and you will come to know that they have developed poor self-image. They lack confidence to face their peers in schools and colleges because of their acne. It is so very important for them. It may not be important for you, but for that child it is so very important. And believe me, studies have been done by psychologists and psychodermatologists, where they have shown that 65 to 70% of teenagers suffering from acne suffer from anxiety, depression, social withdrawal problems.
My God.
Imagine, it is that high. It is that high. But those kids don't talk about it. Because they are scared of their parents. They cannot communicate freely about these kind of feelings that is going on in their, mind. So that's why it is very important, to address these issues.
Oh, I mean, definitely, because it's my face, and I am going to be in that particular age, जहाँ पर girl and boy they get attracted to each other, and when your appearance is not you yourself you are not confident, तो of course वो एक demean वाला feeling आता ही है,
Yes,
and then
yes.
you become a कहते हैं ना कि वो एक हंसी का पात्र बन जाता है उसके दोस्तों के बीच में.
Yes,
सो
absolutely.
दैट्स रियली समझने वाली बात है कि एक्ने ये एक प्रॉब्लम नहीं है, तो ये एक डर्मेटोलॉजिस्ट के पास जाना मतलब ये कितना ज़रूरी है टू हैव योर कॉन्फिडेंस बैक इन एक्शन.
Absolutely.
ओके डॉक्टर साहब, व्हेन वी टॉक अबाउट गोइंग टू द स्विमिंग पूल, ओके, फिटनेस हमको जाना है, हम स्विमिंग पूल में जाएंगे, देयर इज़ अ क्लोरीन वाटर. There are some swimming pools which don't use chlorine, but of course, when we are using a swimming pool which is completely, used by different kind of people, so definitely some or the other chemicals are going to be used. Second, if I'm using, I'm going on a beach, okay. So whenever I am not using my regular water, which is coming from my tap, okay, I'm going out. We use sunscreens, right? How effective is that sunscreen when we use these kind of creams, when we use these kind of infrastructures? तो ये sunscreens कितना important है?
Yes. Now it is very important to use a sunscreen for every single person during the day. Okay. And when you go to a swimming pool or a beach or a water park or even to a hill station at high altitudes, it becomes all the more important to use a sunscreen. Because the amount of UV rays reflecting from water bodies, from sand bodies even in the desert and at high altitudes is the highest and will affect your skin more than when you are at ground level.
Oh.
Okay, number one. Number two, we have special water resistant sunscreens which are available. Okay, which the person has to apply 15 minutes before entering the pool or a water park or a beach water. And the effect usually lasts for about 45 minutes. That means you have to come out of the pool, gently dab dry and reapply the sunscreen before entering the pool if you want to stay longer than 45 minutes.
Okay.
Now, most of the people don't do this, and that is why after a holiday in Goa or Andaman and Nicobar come back to me, that I use the sunscreen that you prescribed, but I have still tanned myself or burnt myself. Then I ask them, how did you use the sunscreen? How frequently did you use the sunscreen? How much of the product that you used for your face, for your arms, for your neck? That is also very important.
Okay, now just out of my curiosity, going to a swimming pool, okay, if I'm using a infrastructure wherein the skin tone goes more little tan, okay, what is the application of cream I should be using? Should I use this much? Should I use this much? What is the proportion? कैसे पता चलेगा कि वो ट्यूब में मुझे कितना निकालना है? Because I am not in the zone of applying cream. I am in the zone कि मुझे स्विमिंग पूल में जाना है, या तो फिटनेस के लिए जाना है या तो एक्साइटमेंट के लिए जाना है. तो वो सनस्क्रीन मैं कैसे लगाऊं? Because we see lot of things in the lot of parties which are done on cruise. Okay, we use a lot of infrastructure. अभी आजकल एक नए नए इंफ्रास्ट्रक्चर शुरू हो गए, यॉट पार्टी. तो वहाँ पर भी वो स्क्रीन लगाते हैं, वो सनस्क्रीन लगाते हैं. तो कितनी मात्रा की सनस्क्रीन होनी चाहिए?
Sure, sure. See, for the face and for the neck, you need at least 1 finger length of the cream or sunscreen.
Oh,
That much to give adequate protection to your skin. So
Okay.
imagine the amount that you will need for
तो
your.
आधी ट्यूब खत्म हो जाएगी.
Yes, that is why lotion based sunscreen should be used and not gel or cream based sunscreens when you want to go to these places.
Okay, so
Yeah.
application of these things. And जैसे मैं पानी के संपर्क में आऊँ, उसके 15 मिनट पहले मुझे ये अप्लाई करना है,
Yes,
बराबर है?
that is very important.
एंड उसके बाद जब व्हेन आई एम आउट से आउट आफ्टर 40-45-50 मिनट्स, जब मैं बाहर निकलूँ तो आई नीड टू डैब इट.
Dab dry, reapply the sunscreen if you want to re-enter the pool again. If you
Oh.
don't want to go back into the pool, have a shower and then again apply the sunscreen.
ओके, अगेन आई हैव टू अप्लाई
The sunscreen even, yes, you don't go back into the pool or into the beach.
ओह, एंड
Yes.
इन नॉर्मल रूटीन लाइक अभी मार्च अप्रैल मई 3 महीने तो तपती धूप मुंबई में रहेगी. वो लोग पब्लिक ट्रांसपोर्ट का यूज़ कर रहे हैं, ये पोल्यूशन ऑफ कोर्स इट इज़ एट इट्स पीक. तो वहाँ पर भी सनस्क्रीन लगानी ज़रूरी है?
Yes. Everyone should start using the sunscreen from mid 20s. You know, it is very important to understand this. If I can oversimplify, I tell my patients, you know, that if you start using sunscreen from the age of 25, you will have 60% less superficial wrinkles on your face by the time you hit 60.
सुपरफिशियल रिंकल्स बोले तो?
Yeah, the very fine lines that we develop on the skin.
ओ.
They are superficial wrinkles. So that is a kind of motivating factor for them, you know. And it is such a cheap way of postponing aging, you know. So everyone should use a sunscreen. Now, depending upon the type of skin, the season of the year or time of the year, you know, one should select a sunscreen after consulting a dermatologist.
ओके. नाउ मार्केट में कैसे पता चले कि दिस इज अ परफेक्ट ब्रांड फॉर मी? ओके, दिस इज अ परफेक्ट प्रोडक्ट फॉर मी. एवरी प्रोडक्ट whatever they glamorize saying कि this is the best. I still remember the King Khan showcasing about Lux soap with so many beauties behind. वो एक ब्रांड है, मैं तो ब्रांड के पीछे पागल हो गया, मैंने वो खरीद लिया. मुझे नहीं पता वो राइट है या रॉन्ग है. सो नो ऑफेंस टू एनी ब्रांड्स, बट हाउ डू आई आइडेंटिफाई दिस इज द परफेक्ट ब्रांड फॉर मी?
Yeah.
And specifically, I have seen many times which you have recommended as a face wash. It is not, I mean, it is never branded anywhere. जैसे आपने एक मुझे recommend किया था मेरे पर्सनल यूज़ के लिए, was एथिलो, राइट? पिंक कलर की एक ट्यूब थी. वो मुझे कभी मुझे वो एडवर्टीजमेंट में नहीं मिली. एंड वो दवाई नहीं है, वो एक नॉर्मल प्रोडक्ट है जो आप मार्केट में जाते हो और खरीद के लाते हो. सो इसका अवेयरनेस कैसे हो सकता है?
Yeah. Now, see, it is always better to consult an expert in the field. So, you should definitely take the help of a dermatologist in selecting your sunscreen also.
ओके.
Okay, that is very important. Okay. And like we were talking about the type of skin, the dermatologist will decide what type of skin you have and then recommend a product accordingly. One size does not fit all. Okay. Now, for the Indian skin type, using a sunscreen with SPF of 30 or more is good enough. We
What is
don't
SPF?
have to use a SPF sunscreen with 100 SPF, you know. So I'll tell you in short what does SPF mean so that, you know, the audience understands, you know, from their perspective, and it will help them in selecting a sunscreen, you know. So don't go by ads promoting higher SPF sunscreens. Like I said, an SPF of 30 or more is good enough for Indian skin type. SPF stands for sun protection factor. Okay, so it is a measure to what extent the product protects our skin from UVB radiation. Only UVB radiation. Mind you, UVB radiation burns our skin. It is the radiation which tans our skin and burns our skin, you know. So, it protects you only against UVB,
radiation. Okay.
which is maximum from 10 in the morning to 4 in the afternoon. Okay. That is why, the scientific community found out that all these years the sunscreens were focusing only on the sun protection factor, which was protecting against UVB. But people would still suffer from skin changes. Then other protectants were added to the cream and it started protecting patients from UVA radiation also.
Okay.
And that is designated by the PA factor in 1 plus, 2 plus, 3 plus or 4 plus range. Now, it is the PA factor which determines the degree of protection from UVA rays, which causes premature aging, which causes pigmentary changes in the skin. So, nowadays it is important to use a sunscreen which contains both UVA and UVB protecting agents.
Okay.
And to take it a step further, nowadays we have sunscreen to protect us from infrared radiation, which is generated from heat. We use a lot of remote control devices, Bluetooth devices, day in and day out. They emit infrared radiation. We use our mobile phones, which has become a part of our body, like our shirt and pant. We are exposed to laptop radiation, tablet radiation, desktop computer radiation. All these emit blue light. So now we have sunscreen which contain agents which protect us from infrared radiation and blue light. So that has completed the sunscreen.
So it is sunscreen is not only about going in the sun.
Yes,
and
yes.
Taking the protection.
Yes.
From UV rays.
Yes. So a lot of people ask me, I leave my house at 6 in the morning, 6:30 in the morning, reach my office. I stay in the office till 5 in the evening. And then when I leave, it's already sunset. Do I still need to use a sunscreen? Yes, you still need to use a sunscreen because going to a window or going out for tea during lunch break is good enough to damage your skin. So that is why even when you are indoors, you have to use a sunscreen. Now, a lot of people, stop using the sunscreen during monsoon or rainy season, thinking that there is no sun. Why should I use a sunscreen? Okay. The UV rays pass through the clouds also. 80 to 90% of UV rays pass through the clouds and hit your skin.
So it is only if you don't see the sun.
Yes. It is only the visible light which does not pass through the clouds. So your skin is getting tanned, your skin is getting damaged, when you are walking around during the rainy season without applying a sunscreen.
So sunscreen is not only about screening from
sun,
UV rays.
Yes.
Okay, but it is also about those rays which are not seen.
Yes.
It's all about science. So sunscreen, moisturizer, like for example, in the winter, we have a lot of dry skin. Okay. So sunscreen, फिर moisturizer or moisturizer, फिर sunscreen.
Yeah. See, in the morning, what we should do is we should wash our skin first. So cleanse first. Okay. Then you can use a serum like a vitamin C serum, which will have antioxidant effect, plus it will detan your face. Okay. Make your face look clearer. Then apply a moisturizer and then the sunscreen. Okay. Now, if you have oily skin, then you should use a lightweight moisturizer. And if you have a dry skin, then you should use a heavy moisturizer or a cream-based moisturizer.
Heavy moisturizer?
Meaning a cream-based moisturizer. Okay. Lightweight moisturizer means water-based or gel-based moisturizer. Now, at night, you should cleanse your skin thoroughly, okay, then apply an active product like a serum containing retinol which has anti-aging effects, okay, followed by the moisturizer. Then you don't have to apply the sunscreen at night.
Okay. Okay. So we'll understand this more better for our common people. Our audience who is using public transport or bike or auto, that time they are putting the scarf, they're putting the goggles, they're putting the helmet. Okay. सो उनके लिए जब वो मॉर्निंग में उठते हैं से लेके रात को सोने तक, ऑफकोर्स अभी मुंबई के स्टाइल में, लाइफस्टाइल में लोगों के ध्यान में ये नहीं होता है कि ये प्रोडक्ट में इतना एसपीएफ होना चाहिए, ये मैं क्रीम बेस लूँ, कभी यहाँ पर नहीं मिला तो भाई मैंने जो ले लिया. I completely have that respect towards those people who are really working right from morning 7 to late night 12 o'clock. ऐसे के लिए एक बेसिक क्या डूज एंड डोंट्स होने चाहिए. जैसे अभी हम उठते हैं, हमने उठते के साथ स्प्लैश किया, ठीक है, उसके बाद में हमने उसको डैप किया, उसके बाद हम स्नान करने को गए, बिकॉज कोई इमीडिएटली जाता नहीं है स्नान करने को, कोई पहले चेहरे पे पानी मारेगा, उसके बाद में फिर वो पहुँचेगा, उसके बाद वो स्नान करने के टाइम पे भी कभी कभी ऐसे है तो लोग 2 मिनट में स्नान करके आ जाते हैं, क्योंकि उनको ट्रेन पकड़नी होती है, उनको सिग्नल क्रॉस करना होता है बाइक से या गाड़ी से, या उनको पंच करना होता है. सैटरडे संडेज कभी कभी कोई किसी को मिल जाता है टाइम, तो लोग आधा घंटा स्नान कर लेते हैं. बट ये जो फास्ट एंड फॉरवर्ड लाइफ है, उसके लिए हम क्या क्या कर सकते हैं. जैसे आपने बताया सनस्क्रीन इज इम्पॉर्टेंट, आई अंडरस्टैंड नाउ कि वो आप रेनी सीजन में भी रहोगे तो भी सनस्क्रीन लगाना ज़रूरी है. अभी मेरा ये मिथ टूट गया कि सनस्क्रीन सिर्फ मेरे को स्विमिंग पूल में जाऊँगा तो लगाना है. सनस्क्रीन मेरे को रोज़ लगाना है. मॉइस्चराइज़र ऑफकोर्स मुझे लगाना है जब भी मुझे ड्राई स्किन फीलिंग हो. तो what are the basic things which I should be taking care of my skin?
Yeah. See, now I tell everyone, keep your routine very simple and very consistent. Then only you will be able to follow it for life. If you complicate things, you will do it for some time and then skip the most important part of it. So get up in the morning, cleanse your skin with the right kind of cleanser recommended by a dermatologist. Okay, simple. Apply a sunscreen and leave for work. At least you can do these two things for yourself to stay young and healthy.
Okay.
Same thing at night. Okay, cleanse your skin because you've been exposed to so many pollutants during the day. Your face becomes oily. You have applied a sunscreen. Ladies apply makeup on top of the sunscreen. That has to be removed because the skin has to breathe at night when you are sleeping, when you are resting. Okay, to renew itself. So it's important to again cleanse, and that time you don't need a sunscreen. You just have to moisturize if you have dry skin. If you don't have dry skin, then you don't even have to moisturize. You just use an anti-aging product if you want to.
Okay.
So it simplifies the whole process.
Now we were talking about face. Okay. हम अभी पैरों पे आते हैं, right? Which is always dumped in socks, shoes, clothes format में होते हैं. Maximum male.
Yes.
अगर हम features देखें तो they are always covered with socks. They are always covered with leather shoes. They are always covered with sport shoes. इवन इन महिलाओं के केस में बहुत कम टाइम पे दे यूज द क्लोज शूज, बट इन द एंड ऑफ द डे देयर इज अ वेरी ड्राइनेस इन द फीट एंड बहुत रूखे हो जाते हैं. ओके, उसके लिए क्या है? उसके लिए भी सेम मॉइस्चराइजर, सेम सनस्क्रीन वगैरह डालना है?
नो. See, if men to always keep their feet covered usually, if they don't wear shoes and socks, then their skin can also become tanned like how we tan our faces. Again, at night patient has to use a detanning cream. Okay, and during the day a sunscreen for the feet also if you don't wear shoes and socks. But if you wear shoes and socks, then you are protected most of the times. Then you don't need a sunscreen to be applied to the feet.
When that वो sweaty elements जो होते हैं,
yes.
और उसके बाद
so we have gel based, water based sunscreens which are non-sticky, which a patient can apply, and then wear the footwear.
Okay. Yeah. So even in the night, males should take care of all these things?
Yeah. If you sweat throughout the day, sometimes you must have experienced, foul smell emanating from your socks after you remove them at night. You need to wash your feet thoroughly. And if they go dry, particularly during winter months, just apply a moisturizer. There are special foot moisturizer available. You can't apply the face moisturizer to your feet. Okay? There are body moisturizers available.
Okay. And when we talk about the foot, जब हम पैरों के बारे में देखते हैं तो सॉक्स निकालने के बाद एक बदबू आती है, ठीक है? कभी कभी कोई ज़्यादा स्वेट करता है, उसमें से एक बदबू आती है बॉडी में से, जिसे हम कहते हैं पसीने की बदबू, या सॉक्स निकालने के बाद उसकी जो बदबू आती है, उसके लिए व्हाट आर द रेमेडीज विच वन शुड टेक? तो जैसे मैंने कहा कि फास्ट फॉरवर्ड लाइफ है, लोग डीओ यूज़ करते हैं, कोई नहीं करते हैं, नेवर नो, बट उस दौरान व्हाट आर द थिंग्स वी शुड बी टेकिंग केयर ऑफ?
या सी नाउ the this thing smell, bad odor which emanates from the armpits in lot of patients is because of the effect of a certain type of bacteria on the sweat that is produced. Okay, now by using a deo or perfume, you are only masking that effect, you are not treating that effect. So two simple things to be done: shave your armpits regularly, okay, and apply an antibacterial cream prescribed by a dermatologist to your underarms for a couple of weeks, which will get rid of the bacteria and you will stop suffering from bad odor.
Oh.
It is so simple to treat. But most people continue using deodorants and body sprays for life to mask that effect.
So they don't treat it.
They don't treat the problem.
उस पर उन्होंने और एक मास्क लगा दिया जो
to hide it. Yes.
So when we are talking about cleaning the armpit regularly, so when we talk about having our body parts, private body parts cleansed, so do we have to shave it regularly?
Preferably, yes. You should shave your intimate parts regularly. Apply hot water and use the right kind of shaving razor to shave it. You don't need anything more complicated than that. You don't need special hair removing creams or lotions to remove that hair.
Not required.
Not at all.
So any medical
good quality razor
yes. will help.
Yes.
And do we have to completely remove the hair from the intimate parts or not required?
No, it's like keeping a stubble also, on your face. So you can keep a stubble also. It's not necessary that it has to be clean shaven.
So every 10 days, 15 days?
Even once a month is good enough.
Okay. So because all these things are very personal hygiene जो लोग openly बात नहीं करते हैं, but definitely कभी-कभी कोई और of course thanks to Insta and thanks to all these new products which are coming up in their own formats of ads, अब ये चीज़ों के ऊपर कोई बात नहीं करता कि भाई बदबू आ रही है तो उसके लिए क्या करना चाहिए. So people, अरे तुमने डिओ क्यों नहीं लगाया, अरे put a perfume, you should smell good. तो smell good is good, but how to smell good is this thing which we learned today. So when we talk about skin, we talk about UV rays, we talk about sunscreen, we talk about getting tan. ये जो fair and lovely, I mean no offense to any products, but ये जो claim करते हैं कि ये tan को मात्रा कम होती है, ये seriously ऐसे कोई होता है ऐसा product?
Yes, absolutely. So if you use the right kind of product, for reducing the tanning or the pigmentation left behind by, for example, acne or pimples, definitely there are certain scientifically studied products which can be, prescribed to the patient to get rid of all these spots,
Okay. So
it definitely works.
Work करता है.
Yes, absolutely.
So when we talk about the dark circles, ये यहाँ से यहाँ तक लोग सोते भी काफ़ी अच्छा है, और आजकल तो डेफिनेटली थैंक्स टू दी OTT युग लोग तो बिंज वॉच करते हैं, उनको तो बहुत मज़ा आता है, 2-2, 3-3, 4-4 बजे तक बिंज वॉच करते हैं. सो ये तो लोगों को पता है कि मैं सोया नहीं हूँ इसलिए डार्क सर्कल्स है, लेकिन फिर भी कुछ ऐसे लोग हैं जिनको डार्क सर्कल्स दिखते हैं, और डार्क सर्कल्स तब समझ में नहीं आते हैं, वो ग्रेजुअली समझ में आता है, और वो एक बार डार्क होने के बाद लोगों को समझ में आता है अरे भाई तू बीमार है क्या.
राइट.
So how to take care of all those things?
Yeah. So we have to first understand the common causes of dark circles, and then I will address the problem, how to solve it in a simple manner. One, again, our genes. If there is a family history of pigmentation around the eyes, it increases your chance of suffering from dark circles,
Okay.
or what we call as periorbital pigmentation. Then defect in your genes, to develop that kind of excess pigmentation around your eyes. The other factors come later. Okay, so it may be nutritional deficiency. So vitamin B12 deficiency, iron deficiency can cause dark circles. Lack of sleep can cause dark circles. Late nights can cause dark circles or worsen dark circles. Sitting in front of the computer for long hours, your laptop for long hours can worsen dark circles. If you are mentally disturbed, it can worsen dark circles. So there are many aggravating factors for dark circles. There are certain skin conditions in which you get pigmentation around the eyes. Now, depending upon the cause, we treat these people. But for most of the people, they have to follow a healthy lifestyle, like you pointed out, and use simple creams or serums prescribed by the dermatologist for the periorbital area to take care of the dark circles. But once again, a sunscreen should also be used around the eyes, because the UV rays are affecting the skin around the eyes also and worsening your pigmentation. Okay, and plus, it is important to take good care of your eyes, not just the skin around the eyes. So you should not neglect your eyes also at the same time.
होम रेमेडी जो हमने हमेशा देखी है, 2 ककड़ियाँ डाल दो और बस सो जाओ. So is it really works?
There are a lot of home remedies for dark circles. Now, all these contain natural fruit acids, which are now being extracted in a scientific manner, concentrated, bottled, and we as dermatologists are using them as peels.
Okay. So applying the cucumber in the night for 10-15 minutes is always
does help to a certain extent.
Okay.
But for a busy person, it is very cumbersome. For the housewife, it's easy, to do all that. For a working professional, it's very difficult. It is easier to apply a cream which has a higher concentration of the same compound, which will be more efficacious, for the same problem.
Of course, हाउसवाइफ के लिए प्लीज डोंट टेक ऑफेंसिव. आप लोग भी बहुत बिजी रहते हो, नो डाउट अबाउट इट. When we talk about serum, what exactly this serum is all about? I mean, ये serum होता क्या है?
Yeah. See, serums are, agents which penetrate in a much better fashion. So the active ingredient in that base penetrates the skin better, works better than a cream base or lotion base.
Oh.
So that is why, we are shifting to serums. So for example, vitamin C in cream formulation and vitamin C available in serum formulation will be definitely better than the cream formulation, because it has better penetration into the skin. Similarly, we have serums containing niacinamide for treating the redness or pigmentation left behind by acne. We have anti-aging serums containing retinol. So say 20-30 years back, we used to prescribe retinol containing creams. Now we are prescribing retinol containing serums, because of this fact that penetration is better, increases the efficacy of the product.
Okay. Now, sir, there is, when we talk about having a tanning of skin, there are a lot of parts of our body which are never showcased. Okay. They are always dark because of शायद चल चल के आपके इनर थाइज में भी टैन हो जाता है, आर्मपिट में भी टैन हो जाता है. उसको हम कैसे ट्रीट कर सकते हैं? इज देयर एनी option of
treating these areas? Yes.
These areas.
Now, the pigmentation that people suffer from, around the neck, underarms, and inner thighs is associated usually with obesity. Number one, it is associated with consuming lot of fried food, junk food.
Okay.
Okay. So when you make these necessary changes, it reduces the pigmentation. So it's a condition known as pseudoacanthosis nigricans, okay, in which the pigmentation around the neck, underarms and inner thighs increases. So by adopting a healthy lifestyle and following the right kind of diet, it goes down to a certain extent. If your hormones are not greatly disturbed. So there are other causes also of this pigmentation.
But do we have any cream or medicines which can
So
detach that part?
Yes, so we have creams, containing kojic acid, silymarin, arbutin, and similar products, low concentrated glycolic acids, which are prescribed to treat these sensitive areas.
And how much time it takes to treat?
See, for any skin pigmentary problem, one has to patiently wait for at least 8 to 12 weeks to see results. People normally use it for 2 to 4 weeks. They don't see results. They are disappointed. They stop using the product and shift to a new product. That should not be done.